Hi everyone, I'm Dr. Soni. Today we are going to be doing lip fillers, and this is probably one of my favorite procedures to do. There are many different techniques on doing the lips. You can certainly do it with the needles. People often talk about the Russian lip technique. For most of my clients, I prefer to use microcannulas for a bunch of reasons. First, it really produces very soft, beautiful, natural results. Second, I typically don't get a lot of swelling or a lot of bruising because there's only going to be 2 points of entry. It allows me to gradually and slowly build up the lips. And my goal when I do the lips is just really kind of modest improvements. You want to look like, you know, when you have your lips augmented, that they are the types of lips you're born with. And in general, if you have smaller lips, sometimes you have to really do multiple syringes, but you want to really build the lips a little bit slowly so that you don't really get filler that migrates or really causes too much of that protrusion or duckiness. So I've already gone ahead and numbed her, and I don't use numbing cream. I actually do modified dental block. 95 to 98% of the times my clients feel zero pain whatsoever. Sometimes there could still be a little bit of pinching and pressure, but this is typically the best way to do it. So she's already been numbed. I've already had my entry sites, and this is a micro cannula. So we are going to go into the entry site, and the important thing to remember, tiny pinch, my dear, is you want to be relatively superficial in the lips, and that really creates more of that vertical height. You want to just do small amounts in the lips. And again, you can see the tip of my cannula is right there, and I'm right underneath the vermilion border. And most of the fullness should go in the central part of the lip. You don't want too much fullness on the side. You want it to taper down. We're almost done on this side. And you can see as I'm injecting, you'll see the lips start to lift up and elevate just a little bit. And the reason you want to be superficial and be able to see that tip of that cannula, which is that white dot, is that you really create a little bit more vertical height as opposed to forward protrusion. Now we're going to focus a little bit on the bottom, right over here. Again, you can see my tip of the cannula where that white dot is. We're going to start, and you can see the lower lip will start to extend and come just a little bit forward. And again, we're going to go back. We're going to finish it up. And that's really going to create a nice little pout. And the right side is done. As you can see, there's very little pain that she felt. Some people feel that by giving anesthetic on the inside, you can distort the lips. I've been doing this for almost 2 decades, and I absolutely don't feel that to be the case, because we're doing small amounts on the inside. And so again, here's the cannula. Right there you can see the tip. We're just going to slowly start to build, and you'll see that lip start to come up actually. And then I'm going to go just a little bit underneath it and start focusing on the body. So this side is done, and we're going to finish up with the bottom. You can see the tip of the cannula, and we want that maximum fullness in the center. And as I start putting the product, you'll see that lip expand beautifully. We're going to go back in the body and put a little bit more, and we're almost done. And that's it. Now, you can see how comfortable it was. I didn't get any bleeding whatsoever. There's going to be a little bit of swelling above the vermilion border. That is not product, that's just a little bit of edema, because we were careful to make sure the filler has been placed underneath the vermilion border. I'm most certainly going to massage it out, make sure there are no lumps or bumps. It's very smooth. These are the only two entry points that I use to go in, and usually most people will get swelling for 24 to 48 hours. Lips can take anywhere from 1 to 3 weeks to fully settle down. What I like to tell my clients is that right around the first week to 10 days, they're really going to love them because they're a little bit swollen. Sometimes there is a little bit of sadness when more of the swelling is gone, so I certainly recognize that. But again, when you do the lips, especially if you have smaller lips, you want to build them slowly. And we're also finding in some patients that the lip fillers do hang out a lot longer than we originally thought or anticipated. So sometimes I may make my clients wait several years in between the procedure, because you certainly don't want to have too much product accumulate. You don't want to have it migrate and other issues and problems that can develop from really expanding and augmenting the lips too quickly. And don't forget, up until March 31st, you're going to get double Alle points on Botox and Juvederm. So I hope this helps you. Feel free to ask any questions. Again, at Ethos, we really kind of focus on more conservative treatments. I want people, after they've had their treatments done, to walk out and look like they were born with kind of the enhancements and the procedures that we did. We want to attract positive attention. We don't necessarily want to draw negative attention from, having too much volume in our faces. And I think the general consensus, at least nowadays, is to kind of probably scale back on the fillers. And for those people that are a little bit averse to doing fillers, we have other products called biostimulators, like Sculptra, as well as Radius, that can give you much subtle results as well, without necessarily having to put fillers like hyaluronic acid in. But at the end of the day, the results you're going to get is going to only be good as the injector who's doing the procedure. I can just as easily use hyaluronic acid fillers like Juvederm and create a very beautiful natural result. All I remind you is that just go slowly, be diligent in picking your injectors, and ask lots of questions. Have a great day.